Hey everybody, my name is Erica McMillan, and for my SOPHIA, I'm going to discuss the long-awaited reforms in our country's healthcare system. On September 22, 2010, a large portion of the Patient Protection and Affordable Care Act took effect. This law was developed by Congress at the urging of President Obama and was signed after an arduous and controversial Senate battle in late 2009 and early 2010. Its proponents, who are mostly Democrats, celebrate its expanded consumer protections and extension of healthcare coverage to uninsured Americans, while its Republican opponents express concerns over costs to the country in the forms of possible increased taxes, expanded bureaucracy, increased premiums, and decreased access to care. The law took effect about a week after the U.S. Census Bureau released a report finding that the number of people without health insurance coverage rose from 46.3 million in 2008 to 50.7 million in 2009. And so the changes are becoming important to an ever-growing group of people. This SOPHIA will outline the new changes and open discussion about the possible repercussions. Starting now, insurance companies will no longer be allowed to exclude children because of pre-existing health conditions. The White House predicts this new regulation will extend coverage to 72,000 children. Some insurance companies have argued that because of this regulation, they're going to have to stop offering insurance to children in general because of the liability. The new law also forbids rescission, which is the practice of insurance companies nullifying contracts with customers after they become sick if the reason for the termination of the contract is because of technical mistakes on the consumer's application. Insurance companies are also now required to offer coverage to young adults under the age of 26 if they're on their parents' policies. Some people will no longer have to pay copays, coinsurance, or meet their deductibles for preventive care that's backed up by the best scientific evidence. That includes vaccinations, mammograms for the time being at least, colonoscopies, and even diet counseling for adults at risk of chronic disease. It also allows consumers who change insurance plans to keep their own doctors and to appeal insurance company reimbursement decisions and rejections to a third party. The law in its entirety is projected by the White House to cover 32 million uninsured people and to reduce the deficit by $142 billion over the next 10 years. And according to the White House, the law will result in no more than 2% increase in premiums, which have increased by double digits recently within certain insurance companies. And these projections have been highly disputed by both sides of the argument, and the economics behind this law are extremely complex and difficult to tease out. An important point to remember is that many of the changes are not required of existing health plans, which will be grandfathered in. Only new plans and existing plans that change substantially on or after September 23rd must provide this benefit. Most of us in this class have insurance offered through our employers, and so these changes will not directly affect our coverage. The newly enacted reforms bear particular importance for the 14 million people who must buy policies on the individual market rather than through employers, and they are currently at the mercy of the industry in terms of what they have to pay and what benefits they get. So what do you think about this new change? Has the law gone too far in expanding regulation of the private insurance industry? Has it not gone far enough in extending care to the uninsured or underinsured? Do you think it's dangerous to introduce these reforms at such an economically tenuous time for our country? Are you concerned that the proponents of these changes had to go through such political acrobating in the Senate to get the law passed? Do you think these changes address what you see as the greatest weaknesses in our country's healthcare system? And lastly, how do you think these reforms will affect your practice as a nurse and an advanced practice nurse? There's a lot of political cartoons about this topic, but this one illustrates the current paradox for many people who have to fall below the poverty line to be eligible for Medicaid before they can get health care when insurance is not offered through their employers. And for this discussion, I drew largely from an article in the New York Times from last week, and I also used information from the U.S. Census Bureau. Thank you very much.